Okay, so here's a quick follow-up on a case. This is a patient's all-on-4 prosthetic that we scanned. We're actually going to have the lab remanufacture it in a slightly different color of pink. The gums are way too pink, and the patient has some concerns about that. I did too, but we were already in the process and didn't want to push dates back, so she wore it for a couple of weeks, and now we decided to remake it. Anyway, so I'm going to send this to the lab, the STL file. They can actually reprint this, and I'm hopeful that they'll be able to put the temp cylinders in there for me, since we have a pretty good scan of where they go, and that way when the patient comes back in, I won't have to do any conversion and pickups and stuff. Anyway, I'm going to tell the lab that I want more of this color of gingiva as opposed to this bright pink. I'm not sure, maybe they were running low on regular pink. But the case went really, really well. The implants that we used here are Neodent GM Helix implants. I used a surgical guide, also a bone reduction guide. This is, again, 2 weeks post-op. I mean, we're only looking at the prosthetic, but the prosthetic looks really good. So I trimmed off the palate. It was about a half palate. I trimmed that off today at the patient's request, and it should be fine. Adjusted the occlusion a little bit, but generally the lab they really nailed it. It turned out really, really nice. So I was really impressed with how easy it was to scan this prosthetic with the iTero. We have the iTero 5D. So you're literally just holding it and scanning it around and working your way around it. Of course, with a removable appliance or a scan, anytime you do that, you want to disable the auto cleanup because it's trying to clean up what looks like gingiva, and that doesn't work when we're trying to capture gingiva or capture, things that aren't teeth. So disable that auto cleanup. Turned out really, it was super easy to scan. I probably could have captured the inside of these a little bit more, but hopefully the lab will be able to work with these interfaces. So I thought I'd give you a quick report. This has been a really pleasant, positive experience. Again, the labs that I worked with, the surgical guide lab, sent their proposal right over to the restorative lab, and so they were able to create this prosthetic which required minimal opening of these access holes. They were already there. I did open them a little bit wider just to make sure we had totally passive fit, maybe a little wider than I should have, but it turned out really easy. Very nice. It's guided surgery. Having everything printed ahead of time is just makes your life a lot easier. So I'll give you some follow-up down the road on this case if I have some time, but this was a really great, simple case, again using guided surgery and having a pre-made, pre-opened prosthetic for the conversion made it just so much easier. So anyway, that's all I got for you. Thanks.